We are going to start our session exactly at 11 a.m. Welcome all of you back for the session on subject. I hope all of you know the subject is healthcare and hospital environment. We're going to start exactly at 11 a.m. I'm going to share the screen for all of you. Yeah, I hope the screen is visible with all of you. This is a syllabus for our subject. Let's wait for the participant to join. After that, we're going to start with this session. If no participant is there, then we are going to watch few of the videos on healthcare and hospitality management. Good morning, Priyanka. Dr. Priyanka, how are you?
Yes, sir. Hi, sir. Good morning, sir. I'm good. How are you, sir?
Even I'm fine. In fact, you were missing for last couple of sessions, 2 sessions. So I took
Yeah,
the
yeah,
session.
yeah.
It is
Okay.
available, online recording is available. So there was no student, so I could not interact with anybody. But anyway, because we have to proceed with our all as per the schedule which I have given already to Symbiosis SCOL. So today, what we are going to discuss, let other students join. If they join, nothing like that. But you know the syllabus, right? We have discussed it last time. I want to
Yeah.
discuss. Yeah, I want to discuss something on good communication in healthcare. In fact, the
Okay.
concept video is all about hospital environments and its impact on patient satisfaction. That is, these are the keywords: patient satisfaction.
Mm-hmm.
They're in our
Mm-hmm.
syllabus, and the entire things, the crux of the story is all this unit revolves around this patient satisfaction. Ultimately, whatever we are doing, we are studying, the doctors are working, the
Mm-hmm.
the healthcare staff is working, that is all for patient satisfaction. even the management of this thing hospital, they are all working ultimately for patient satisfaction and patient experience. These are, see, mind you, these are two different things. We're going to discuss on that also, right? So we'll wait for a minute's time and immediately we're going to start. Okay.
Hello.
We're going to, yeah, Priyanka, we're going to wait for a minute's time and immediately we're
Okay.
going to start. Okay.
Till then, you can just tell me a little bit, like 3 prolonged approaches is written there to improve patient satisfaction, and what were the approaches?
Yeah, where it is written? Unit 3.
Yes, sir. Unit 3. I am just thinking that you have covered unit 3.
Yeah, I think I have covered, means even I'm not able to recall because it is way back. I think there was a gap of more than 15 days. So anyway, means whatever is covered, it is there. We're going to start with communication strategies. Unit 3, yeah, I think I've come up till unit 3. Now these 3 units are remaining, but they are quite lengthy in nature. So this people place process approach. See, in brief, I'll explain you, and at the end, whenever we are going to end our session, I'm to say the complete session, you can come out with this your doubts, queries, or whatever thing you have not followed. See, people, process, place model. We can correlate it with the 7 P's of marketing, right? The first 4 P's talks about what? Product, place, price, promotion, right? And the remaining 3 P's out of the 7 P's talk about people, process, and physical evidence. That is place. Right? Yeah. So these 3 P's are important from service point of view, because hospital and what hospital management is based on service. It's a service model, right? Product is not there. You are treating the patient and he's not going to take anything with him or her. जैसा physical product खरीदने जाते हैं अपन, we go and purchase television, that is a goods, right? We call them goods. But when it comes to service, the patient is not going to take anything except few tablets and few medicine and all those things. But what he's going to take back with him or her is a good health, right? A recovery from whatever disease he or she was suffering. So this
Yeah, so we are offering a service to them. So
exactly.
like if they are benefited by the service, then only you will say ki it's like there is a patient satisfaction.
Exactly. If they are satisfied with the service, the service includes not only their fast recovery, not only their cure, but it also involves pricing. See, everything comes with a cost. So if the hospital is charging very high, then probably the satisfaction level may go down, even though the patient has recovered to its fullest, right? So pricing also plays, yeah, pricing also plays a very important role when we talk about 7 P's. And Dr. Priyanka, always remember these 7 P's when we talk about MBA. 7 P's, again, I'm going to repeat it for you. Always product will come first, right? Pricing, promotion, right? Product, price, promotion. Then this 3 P's, one I'm missing out. Product, place, price, promotion. Okay, these are the 4 P's which are directly related to the physical goods, like as I said, laptop, your mobile, your car, automobile, right? And remaining 3 P's are related to service, which talk about people who with whom you are interacting. Here in our case, it is going to be doctors, the medical staff, right? The vendors which are going to come into picture. Then process. How quick is the process? Right from the day the patient is admitted, how easy you are going to make the process for them, and by the time the patient get discharged. Discharge again is not a simple process. Lot many paperwork is required. So as a hospital management, I should make this process very easy and simple, right? Very user friendly. I'm to say the patient friendly. I can use this word, patient friendly. And place here I'm going to say is physical evidence, the environment, the ambience of the hospital. How does the hospital look? How well it suits to the patient eye, right? It should not be too flashy, isn't it? It should be comfortable also. The ventilation, then the light, visibility, I can see, right? So all this thing is related to place. And to say the actual environment, physical environment. That's why it is called as physical evidence. So these 7 P's are very important. Not only from the point of, Yes.
Yeah, it's product, place, price, promotion, then process, and the rest of the two were.
This is process people. People here forms very important part of our topic.
Okay.
Process and people. People are
Yeah.
the are the people with whom you are interacting. For example, as I said, doctors, nurses, the medical staff,
Hmm. Hmm.
the pharmaceutists available over there, right? So these are all people.
Hmm. Hmm.
The people are here. What we mean by people is
People here
people.
does not employs to patients.
No, a patient won't be part of it. People means if I am a consumer
Your
or
own
customer,
staff.
yeah, the staff, the people with whom I'm going to interact. That is what is meant by people over here. People is somebody like if I go to a mall, right? Then the staff out there with whom I'm going to ask for the price, I'm going to ask for the product are going to
Hmm.
be people.
Hmm.
Customer care
Hmm.
service, they are people for me as a customer, right?
Hmm.
So and physical environment. So this is what I've covered last time. But anyway, I'm not going to go into detail of this. At the end of the
Hmm.
session, as I said, 15th session, 1-5, we're going
Hmm.
to commit it exclusively for whatever thing you feel that you have not followed. Okay.
Hmm. 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 Hmm.
Let us move to
Just
our.
one more thing I need to ask you. It's not about this, but actually, I am like doing 2 semesters this year, like first year and third year both. So can I do like that? That few exams of third year, few papers I can submit right today, like in this session, and few later on like that. Few subjects like that.
Yeah, I think, Miss C, I'm not very much versed with the exam system, but anyway, I'll talk to the coordinator, Chandan sir, and I think that flexibility must be there. It must be there.
Because everything in third semester I cannot cover. I'm covering completely first semester and third semester. Few subjects like this subject is like मैंने इसका lecture attend किया and all. So I think it will be easy for me and I can go through it and then I can commit the exam. Like I can do that commitment for the exam
I
that
think
I can do.
yeah, that flexibility should be there, but again, I'll confirm it back to you in our upcoming
Okay.
session, right? Or else, if you have
Okay.
Chandan sir's number, he can definitely solve because see, it's part of admin. In fact, I am not aware of the exam pattern because
Mm-hmm.
in Symbiosis, once I am allotted a lecture, then my focus is on lecture only. But anyway, I should be knowing as a faculty, I should be knowing about this. So what I'll do, I'll talk to Chandan sir, right?
Okay, sir.
I'll ask
Thank you.
for the entire because see what SCOL do. They usually share. See, this is what they have shared with me: the syllabus content.
Mm-hmm.
In fact, the scheme of examination, the scheme of evaluation, I'll ask for
Yeah.
it.
Internal assessment I have to give it so that I can attempt the exam.
Exactly. Internal, you cover up. Good point. Internal,
Yeah.
even if you are not appearing for final exam, internal you clear here itself, so that next time you'll
Okay.
be just appearing for the exam. You don't have to give internal again. Okay.
Okay. Okay.
So internal,
Okay, sir.
every time you have to keep in mind that you submit all the internal assessment and
Hmm.
the exam part, there is plenty of flexibility. But let me check out how many paper you can skip, how many you are supposed to attend to move
Yeah.
ahead. See, it's for so that you can land up in the fourth semester, isn't it? So
Yeah,
keeping
correct,
that,
sir. Because of this only, because like my daughter is really small. She is now 1 year old. So last year I have enrolled, but yet I was the only one person who is like the caretaker and everything for her. So it won't be possible for me to spare the time and do all the things. So this year it's much better looking right now, and because it's summer holidays also for the elder daughter. So I think that I should make out the most of the time, most of it, basically.
Whatever knowledge I have regarding this exam scheme, going to fourth sem, definitely you have to clear first sem. That is for sure, right? If, even second sem, you have to clear all the subject, and I think few subject you can carry. This is what my knowledge goes. But let me because
Hmm.
see, all university they have different exam scheme and different what you can call it
Hmm.
promotion scheme,
Correct,
right?
correct, correct.
So I'll check it out. I think it must be available on the website also, but I'll talk to
Correct.
Chandan. You have
Okay.
his number.
I don't think that I have his number.
Do you want to take it down?
Yeah,
Because
yeah, yeah. You can give it to me.
directly to him,
Chandan sir, na?
Dr. Chandan.
No, no, no. I don't have his number here.
Just a minute. I'll give it to you. Or Chetali madam is also there. First of all take down Dr. Chandan sir number. His number is 830
830
836
836
7787.
787. No, 830 836. These are
Right.
9 digits only. 830.
836 77
Okay, 77. Okay.
7787. Right.
Yeah. Yeah.
One more Chaitali madam is there. Her number is
Hmm.
89
Hmm.
9566
Hmm.
48798.
Sorry, 89566.
89566
Yeah.
48798.
79.
798.
Okay. Yeah, correct.
After the lecture is over, you can just give them a call and
Okay,
they'll
sir.
be able to clear your doubts.
Yeah.
And next
Thank you, sir.
case, if it's not, then let me know about it if your doubts are not clear.
Okay, sir. Yeah. Yes.
So I was talking about Unit 4, that is communication strategy in healthcare and hospital environment. See, whatever communication strategy that goes in a marketing or that goes with any other organization or any other industry, for example, tourism and hospitality management, right? That is again a peculiar service industry, tourism and hospitality management, right? There are many other sectors like automobile sector is also there. There you have a physical product and you have what? You have a part of after sale and pre-sale services, right? Just a second. Yes, sorry, Priyanka. So what we were talking about was communications. You can see my screen, Priyanka.
Yes, sir. I can see. You can go ahead. Yeah.
Communication strategy. See, even though our subject is about healthcare and hospital, but the fundamentals of this communication strategy remain same everywhere. You go to a automobile industry, you go to a tourism hospital, as I said, you go to a banking services, you go to financial services, whatever services is there, communication strategy more or less the fundamentals, right, is going to remain one, and they are not going to change. Again, this is related to 7 P's. Like we have what? Product,
Product,
place,
place, price, promotion, then
right?
process, then people, and then physical environment.
Physical environment, or you can call it place itself, or physical evidence. It is
Evidence.
that is the word used, right? Physical evidence. What actually is available, right? So here, when we talk about product, pricing, then place and promotion. Now, promotion here is related to this what we are discussing, communication strategy. Now, promotion again you can break it down into 5 parts, right? That is advertising. Uh, that then you have PR, public relation. Then you have publicity, right? Then you have uh, nowadays digital marketing is playing a very important, it has formed as one of the important part of communication or promotion, right?
Nowadays, it's important actually.
Every most of the thing revolves around digital marketing, and in fact all this advertisement and all those things I've narrated to you is clubbed into digital marketing nowadays. You do public relations through social media, right? Advertisement is done on your websites, right? They are also done on various other apps also, right? If you open up a if you search for something, and the possibility is that because of SEO, that is search engine optimization, your ad will come up or pop up on the person's mobile phone or laptop. So all these strategies, communication strategy, are now actually what they are synchronized with digital marketing, and which has formed very important part, because see, when we move down to this our units, that yeah, here itself they have used patient portal, right? Patient portal
Hmm.
is nothing but part of digital communication. You can call it. You can call it digital marketing. Also, you can name it, right?
Hmm.
So
Hmm.
this thing, this particular digital thing has made many things very simple. Even see, for example, telehealth is there. Telehealth and its benefit.
Hmm.
Health apps are there. Health apps
Hmm.
nowadays,
Hmm.
pharma is
Hmm.
all those things. They are coming very handy to purchase
Hmm.
medicine online, right? So
Yes, correct.
it is yeah, and it is all for patient satisfaction. Big hospital,
Hmm.
they do have their own patient portal where the patient can enroll, register, can have consultancy. They can consult the doctor sitting at home. They need not every time visit to the hospital, the way we
Correct.
are doing it, right? You
Yeah.
are not physically coming to the college, I am not there, but still we
Yeah.
are able to communicate. It is all because of this digital revolution. You can call it internet marketing also, digital marketing, online marketing, all means one and the same. What is
Hmm.
needed is internet facilities must. If without internet you cannot call it
Hmm.
as digital, right? Like
Yes,
sending
correct.
sms, this sms is not digital, even though it looks like digital, but it is not
Hmm.
done internet. So when we talk
It's
about
simple
digital,
messaging service, basically. It's a
simple,
messaging service. It's
it's a messaging service.
yeah.
It is not nothing
Hmm.
digital about it. When
Yeah.
I'm talking to you
Before
right now, you
internet,
can
also we used to receive SMS.
SMS through internet also. You can like WhatsApp. For WhatsApp you need what net data, right?
Yeah.
Without
Yeah.
data you cannot communicate on WhatsApp. Same thing
Correct.
applies to emails. See here, it is given communication technology using emails and patient portals. So
Hmm.
nowadays, because of all this digitalization, even
Ah.
lot of data, yeah, your data you can extract after a decade's time. The hospital will be storing it in their database, and they can go
Hmm.
back to patient history. It becomes very simple for the hospital. Earlier it was not that. You have to carry your file, the doctor will go through your past history, right?
Yes.
They'll,
Yes. Yes. Correct.
yeah, they'll, if your file is missing,
Nowadays, so they'll give you like prescription, and the reports will also come from the mails only. By mail,
exactly.
they'll send you gentle reminders for your checkups and all the things.
It's even Thyrocare. If you have done your blood test through
Yeah.
Thyrocare, then they'll keep a track that when you have done it, probably it is a year's time, they'll send you emails that it's the right time to do your blood test. At least it has happened. I'm doing a blood test once in a year for almost past 7 to 8 years. So if I missed out the date, which I have done last year, probably they'll keep on doing the follow through emails, through SMS, through WhatsApp message also. Even. And they'll send the report. They'll ask whether you want a hard copy or soft copy, because for hard copy they charge 50 rupees. If I say soft
Correct.
copy,
Correct.
yeah, it comes for free, and it gets stored. Even I can track down my report 5 years earlier. कि 5 साल पहले what was my hemoglobin, what was my creatine, right? What was my urea, all those things. What was my HDL, LDL. So we can track for ourselves also as
You can
patient.
also do it, and then you can go to your doctor, and then suppose the doctor is asking you iska pehle wala report, iska pehle wala report, then you can show, yeah, this was the last report, this was the before that, this was the thing. So he can also make out, okay, the cholesterol levels are like this, or the
Maintain, yeah.
thyroid levels are like this.
Thyroid levels are like this. So he can make out if the patient is doing good, right? Or patient or primary healthcare, we have seen it last time. So this is the
Yeah.
first interaction. Even if I am not suffering from any disease, but I just go for a routine checkup, right? To know whether how I am performing. So for by looking at the history, the doctor can always tell you, fine, you are doing good in this hemoglobin part. You need not make any change in your diet because last 3 years it is almost consistent. What is seen is that your SDL level, LDL level is going up and SDL level is going down. So you have to keep control on cholesterol, right? Isn't it? So don't go for red meat, right? So plenty of diet change he can recommend based on your past history and present report. Present is very important compared to what is
Mm.
past. If present is good, the doctor need not worry about the past also. If your present shows that everything is perfect, everything is fine, probably the doctor might not ask you for the past reports. It is not needed, right? So what I mean to say, communication strategy. It is this communication which is going to make the hospital or it is going to break the hospital. And communication, as you know, communication is usually of two types: verbal communication and non-verbal communication. Right? Verbal communication is something which we are doing right now. I am talking to you, you are talking to, isn't it? So it's a very important communication when it comes to service industry. If you are not communicating, if you are not able to communicate properly, see, only communication is not everything. It has to be done properly. Empathy has to be there, right? You need to go along with the patient. You should be able to understand what he or she is feeling from within, right? So empathy is the proper word, which has to be exercised properly with all the patient, no matter how serious the patient is, or no matter how early stage he's being diagnosed. Okay, so all these things becomes very important to run an organization effectively and efficiently. Communication, as I said, verbal communication is one, which is done through what? Through talking only. There's no other way. Verbal means oral communication.
Oral, yeah.
And non-verbal includes lot many things, like the way I'm displaying the syllabus in front of you. This is a part of non-verbal communication. Right? Talking about the hospital, what can be non-verbal communication?
Non-verbal basically can be your literatures and all things like that, na?
The
boards and all.
Yeah, boards and all. Instruction displayed on the notice board.
Yeah.
Then probably there might be a sign of like keep silence, right? Then follow the track, whatever it is. So, see, whatever is displayed in writing will be the part of non-verbal communication. And again, it has to be done nicely with proper presentation, proper font size, proper font type. There has to be certain uniformity in all this communication, so that you feel like what, that physical evidence part is taken care of, isn't it? Now again, non-verbal communication includes your postures and gestures. See, the way I'm using my hands right over here forms the part of postures. Gestures can be greeting, like smiling at the patient, right? And many a time non-verbal communication plays a very important role, especially in healthcare industry, because most of the hospital are silent zone. You are requested not to talk to the minimum, right? Even the nurses will often keep mum and quiet, and they'll try to talk through the gestures and postures most of the time. You must have noticed it. You won't see the doctors and nurses talking very loudly and using verbal communication too much or too often. Probably they'll use sign language sort of thing, so that the noise pollution, we can call it, sort of the noise is maintained to a minimum level, which is going to help the patient recover fast. Because if there is silence, there is calm and peace and quiet, then the possibility of patients recovering fast becomes manifold, isn't it? But if there is chaos, there's plenty of noise around. Because see, as I said earlier also, outside the hospital you will find the board of no horn, right? That the hospital is right ahead, so please do not horn. The vehicle, the road passing by is instructed not to blow the horn. So the signs are there, so as to maintain the environment of the hospital, right?
Yes.
So let me take you to the slide. Actually, in fact, we are discussing only on syllabus. Just a minute.
Yeah.
I'm seeing your call. Yeah, so in fact, we were deliberately, I was discussing on the syllabus, because the questions which are going to come in the exam will be somewhere from here only, right? You should expect questions from here only. But we can go further beyond, because you cannot say the key syllabus mein nahi tha, there was nothing mention of website, hospital website, only portal. See, portal and website are a bit different. They are not exactly same. In fact, portal can be part of website, but website in itself is a very is a broader this thing, picture of communication. Right? Portal is somewhere you can interact, you can register yourself, then you can ask for consultancy, you can ask for medicine, you can ask for nutrition or diets, right? So that's why we have taken so longer on this particular syllabus. Let us move to the communication, the PDF which I have prepared for you. This is unit 3, communication. Yeah, so this is what is the importance of good communication between patient and health professional. Now, who are the health professional here? Priyanka?
Nurses, doctors, nurses,
Doctor,
and
nurses, and the medical
managers
staff.
also, even
Pardon me?
managers also.
Yeah, they are also part of the people managing the hospital, the management itself, right? Even though
Management, yeah.
each and everybody who is directly or indirectly linked to the even pharmacists
Hospital, basically.
working outside
Yeah,
the hospital.
pharmacist also. Yeah.
Yeah, they can be inside also. It depend on what the management want the pharmacist to do. If they outsource it, probably they'll give the pharmacist outside place, place something just in the vicinity of the hospital, or many a time they might like to set up their own pharmacy so that they can keep a track, they can keep a record. Okay.
Correct.
So here, health professional, right? So the good communication has to be there between the patient and health professional. When healthcare professionals are not communicating effectively, patient safety is at risk for several reasons. Because of lack of critical information, misinterpretation of information, unclear orders over the telephone, and overlooked changes in the status. Lack of communication creates situation where medical error can occur. So that's why communication, you see, if paraphrasing, do you know what is paraphrasing? It is often used in communication, paraphrasing.
No, no, no. No.
Yeah, I'll explain you. See, if you want to avoid the errors in communication, or if you want to avoid the mistakes in communication, then you have to paraphrase the way. See, I've given you Chandan sir's number, and then you have repeated that number to me, right? I've given you the number, and you have repeated that number back to me. Why? To just cross check out whether you have noted the number properly or not, right? That is nothing but paraphrasing, asking the other person to repeat whatever I have told you. You're supposed to repeat it again, so that any error, any mistake in communication is brought to zero. When you communicate, and again if I communicate the same thing back to you, then your communication is done 100%. It is nothing but paraphrasing, which is often need to be done in hospital, because hospital is a very risky business. The patient's health and patient safety is at stake. You cannot play with the patient health or patient safety. So paraphrasing has to be done lot of time. Like if the doctor prescribes something to the nurse, then probably the nurse will read back it to the doctor. Doctor, is it this what you have prescribed? So that communication is both way, it is paraphrased, and the mistakes are avoided. The mistakes are brought to almost zero, because even a single percent mistake or error is not permitted here, because as I said, it's a very highly risky thing to commit a mistake, especially when it comes to communication. See here,
Yeah.
this keyword.
This paraphrases are used in case of verbal communications only. Correct?
Verbal communication, even written also, but it is it is used in verbal only, but written also,
because
like
written you can
written
treat
also.
it properly. If some doubt is there, then only we're going to like ask for handwritings and all.
Second. But many times it is good for taking critical details, right? It is often good that you paraphrase it. You again repeat the same thing to the person who has communicated those things. Same, see, we do it in emails also. We can call it as paraphrasing. Trail mails, you can call it trail mails, right? If you write a mail to me, then on this very same email, I'm going to rewrite back to you, right? Those are called as trail mails, so that you can refer back to whatever you have written, and you can refer to whatever I'm going to communicate with you, right? So
But
let us move.
if I have to return those, so it will be saved in sent items, na? In my box. I can go there and then like have a view at that.
Yeah, it will be saved, but that is more something like paraphrasing only, so that you know whatever has been written earlier, right? But paraphrase, as you said rightly, paraphrasing, right? Paraphrasing itself means verbal. Okay. So we'll stick to verbal only, right? No need to make it complicated. Okay. Now this, see here in this question, this keyword has come. What is the importance of empathy for patient professional communication? This is very important when we talk about patients. You know what is the meaning of empathy?
Yeah, you can put your shoe in like another one's shoe. You put your foot in another one's shoe
Good.
and just
Putting,
feel like
feel like,
feel or like
yeah,
some
you are that person.
similar feelings will be there. Like someone's son is suffering, so it's a general suffering of a human being. You cannot avoid it. Like कि अभी कोई बात नहीं, ये तो सर्दी ही हुई है, बुखार ही हुआ है, it's okay, बहुत सारे बच्चों को चल ही रहा है. No, his son is suffering, so the mother is suffering, the father is suffering, and yes, it's a like there is a concern of health, correct? So you have to address it in a proper way, and you have to be a little bit sympathetic to the patient. Ki okay, yaar, you are suffering, and you will be provided good care, and we'll take care of you.
Right. Good. You have used the word very correctly, putting yourself in the shoes of others, right? So, making yourself look like that you are the same person. I'm not somebody else, but I'm part of you, right? I know what you are feeling, what is the amount of anxiety you are having, right? So it is like getting attached, right? Getting
Yeah.
getting connected by heart and soul, right? Something where you can feel the feelings of others. What are they feeling right now? Right? What are they expressing right now? So it is not only the connection of brain, it is a connection of heart and soul. So that is
And you have to
what.
express it also in that way. Suppose you are
Exactly.
not feeling it that depthly also, but out of this communication skills and all, because you are a professional there, so you have to express it also that way. Ki, yeah, I can understand what pain you are going through.
Exactly.
And we'll do our level best to like make it comfortable for you.
Exactly. Good. So see, the research has shown empathy and compassion to be associated with better adherence to medication. If you have empathy, then probably you can prescribe the best of best medicine, decreases malpractice cases, fewer mistakes, and increase patient satisfaction. Again, this keyword, you have to express empathy if you really want to improvise on the patient satisfaction.
Yeah. So
So
in clinics
communication,
also we have to do it, not only in hospitals. As a doctor also you have to be empathetic.
yeah. No matter what sort of, see, as I said, this is applicable
Otherwise,
every.
people will say that what kind of doctor is this and why we are going there. Like the reviews will come out like this. Nowadays, it's all about Google and all.
Right. And see, people review also doctor. They put comment that he's a very excellent doctor. He knows what I'm feeling. What means
Yeah, he understands the thing. He listens to you properly. All that things will come.
yeah, things are not what it used to be a decade or 2 decades back. Now, because of the digitalization, you become a success overnight, many a time overnight, but it requires a lot of hard work also. And the patient may move away from you if you are not, if you do not have that empathy, right? So
Correct,
बहुत
sir.
बार
It's a very important thing. Yeah.
हाँ, बहुत बार मैंने ये भी देखा है कि डॉक्टर तो बहुत पढ़ा लिखा नहीं है, बट स्पेशली टॉकिंग अबाउट योर प्रोफेशन, homeopathy, right?
Yeah.
So I've seen people reaching the clinic early morning 5 o'clock, because the clinic gets open at 7 o'clock, and if you go at 7, then probably you won't get a chance to be treated on the same day. तो लोग 5 बजे जाके लाइन लगाते, even though that doctor, there are better facility available compared to that particular doctor, especially in Nagpur, right? So but it all depends on how you communicate. See, the crux of the story is you have to be very particular about this empathy and compensation, right? Compensation. So moving further, what is the importance of communication? See, this is we have done, right? Just a minute. Amit, pass another pass. So as I said, communication, see, Priyanka, as I said, not only in healthcare it is very important, very important, but it is
Hmm.
equally applicable to all other industry also. If you don't
Mhm.
have that empathy or that you don't have hold on your communication, then probably you are going to miss out the clients. It can be, as I said, it can be a retail industry.
Correct.
It can be regarding the the grievance the customer has raised, a complaint,
Hmm.
and how quickly it is being resolved. It is all part of communication.
Hmm. Hmm.
So communication is very important, very very important.
Hmm.
And without communication, you cannot move further with I say effective communication. It has to be effective. So what is
Hmm.
the definition? What are the benefits of effective communication in healthcare? See, these are the six I've listed. I think there should be more in number. No, six I've listed, but there are plenty. In fact,
Okay.
talking about healthcare, it helps in what? Immediate understanding of patient's condition and needs. Once the patient is
Hmm.
admitted, you the nurse will go and communicate कि कैसा क्या
Hmm.
हुआ है, कैसा लग रहा है आपको,
Hmm.
कहाँ दर्द हो रहा है, right? कल
Hmm.
टेम्परेचर
Hmm.
there will be plenty of questions, and it starts with the communication. It is a start of communication, right? The
Hmm.
patient would like he or she is feeling so and so, right?
Hmm.
There's a lot of nausea, there's a lot of vomiting. It can be anything, express, right?
Hmm. Hmm.
Understanding the emotional state of patient. See, unless and until you communicate, you will
Hmm.
never come to know how exactly is the patient feeling, right?
Hmm.
So communication has to be done very very properly. You
Hmm.
cannot just ignore this communication part, because
Hmm.
human being, we are the only animal on, I would say we are animals only, but who can communicate verbally. In fact, birds are also there, but their communication is very limited. We can communicate till the state of our emotion. We can understand the emotion of others, right?
Hmm.
So understanding the social determinants of health, tracking changes in care, healthcare, I'm say here, identify, specify specialized needs. What if the patient needs something in addition, advocating for the patient to support karna hai all the time.
Hmm.
Apart from this, communication also play to build a good relation between the healthcare professional and the patient, right? Patient will feel
Hmm.
happy on seeing your face, because you are talking
Hmm.
good to them, and they'll feel that they are being taken care properly. That is going to lead
Hmm.
to satisfaction,
Yeah,
right?
obviously, and you're like if you're communicating well, then the patient feels that you are approachable. Your approachability is also one of the factors. Like, okay, we can go there. At least we can talk to that person there.
Right,
You are
exactly.
approachable.
And surprisingly, this part is very very much missing. This is what I've seen, because I visited so many hospitals in Mumbai, hospitals in Pune, hospitals in Nagpur, and many
Hmm.
a time, like, I do not know what sort of ego, I won't exactly, we cannot call it as ego, but the doctor, they show very little interest in talking to the patient, or at least to their relatives. This is my personal observation. I may be wrong. It may
Correct,
not be
correct.
happening, may not be happening everywhere, but what I
And
see is,
very busy hospitals, they don't have time and all. And like
you
after very, very much years of experiences and all, doctors also become cold and frigid sometimes.
exactly, that is what I
This happens in their field.
they sort of start behaving like God, right? कि जो मैं बोलूंगा वही फाइनल है. Right? I do have certain queries which
Yeah, but they're not going to address also. Like there are few doctors in Bangalore also that I know of. One of them is a very famous orthopedician from Manipal Hospital, and he is like, if you are going there, you have to be mum. Just listen to him, and that's it.
no, that is wrong. See, because now there's plenty. Otherwise, it was okay few decades back, as I said. Now there is plenty of competition. There are plenty of what alternatives available. Slowly and steadily, these people are going to die, because communication forms the very important
Hmm.
part. And patient
Yeah.
want that they should be communicated properly.
Yeah, like for pediatricians, no, if you are going for a pediatrician or a child doctor, even in homeopathy, we also have like lots of patients who are babies, kids only. So for them, it's very important because people have n number of questions about their child, and their
Right.
super most priority is their own child. That's it,
Right.
nothing else.
Exactly.
So
And see,
pediatricians have that kind of values in them, what I think, rather than other doctors.
yeah, that is what I have seen. When I take my daughter to one of the very good doctor they have found is Shende, Dr. Shende, and they said no, we are not going to go to any other doctor because he talks very good. He is having
Yeah.
very small, and I have plenty of alternatives available around my apartment. But we
Yeah,
go from
correct.
almost 3 to 4 kilometer only because that he generate empathy with the patients.
Yeah,
Like
at least he'll listen to you,
listen,
he'll sort your queries out and all. Na? This is what about patient satisfaction if you are going in a clinic basically. And
this
we
is
are
part of,
looking for a person.
exactly. See, and this is part of treatment. I do not know why doctor do not understand that not
No,
only
but my
medicine.
patients and all, this is my first most priority. And wherever I work, it's everyone is telling me that the empathy part of you is like something we should learn from you. You
Exactly.
have
When
to be
it-
empathetic. You have to be even for empathy. You have to go a little bit like what I can say, like
Step-
uh, for you have to step more on that. मतलब
Exactly.
उसके लिए एक वर्ड होता है कि आपको खुद से आगे जा करके बोलना है उनसे कि ये भी कर लीजिए. You have to suggest also little bit more also कि अभी आप खाने का नहीं पूछा आपने, but you have to tell him कि अभी बुखार आया है, सर्दी जुकाम है, ये खाना है, ये नहीं खिलाइएगा.
Yes, exactly. See, you have to move a step further apart from regular practices that are being done. You see, communication forms a very important part. Communication, I would say 50% I give credit for the medicine and 50%
50%
for
तो आदमी
communication.
डॉक्टर के बाद से ठीक होता है.
बात से एक विजिट से भी बहुत बार लोग ठीक हो जाते, चलो डॉक्टर के पास जाके आए. नाउ मेनी पेशेंट फील लाइक they are being treated even though
Yeah,
it's psychological. You have to work on the
yeah,
psychology of the
yeah.
patients, and it is the most powerful tool apart from medicine. Many a
It's a
times the
very
patient might not
important
need,
tool.
they might not need medicine also.
Your
So moving
body.
us,
Okay, sir.
yes,
Yeah,
yes.
we can move.
Yes. So involving patient in their care encourages the patient to take ownership of their health, which results in improved outcome. Ownership of health. See, if you get them, encourage them, and involve them in this treatment part, then they'll start feeling, अरे नहीं डॉक्टर तो इतना बोल रही थी मुझे, तो I should be taking care of this, right? And what it is going to result in? It is going to result in a improved outcome. So
Yeah.
that is the
So it's
impact.
like अभी जो बोलते हैं ये मेरा पेशेंट है, तो मेरा पेशेंट है तो ओनरशिप होना चाहिए, मेरा पेशेंट है.
Exactly.
You are responsible there.
Exactly, that is because see, I've treated my father's more very not exactly very personal, but at the very old age, I've taken him to so many hospitals, and this is out of my experience because he was at the last stage suffering from kidney dialysis. I mean, he was supposed to take dialysis every alternate day, and I've seen how this even very large hospital, that part is entirely missing. I do not know why they are so busy, and I know they are busy, but at the same time, even a banker is busy the entire day, but they do take out their time to entertain you, to solve your queries, solve your problem. So everybody is busy nowadays. Competition is everywhere, and
But this industry will take time because right from the beginning, we are seeing the doctors like this, they'll not talk much and all. And they're like godly figures because भगवान की तरह माना जाता है चिकित्सक तो. इसलिए भी थोड़ा एक ईगो रहता ही है.
इसमें क्या कर सकते, what I can suggest is they can hire a manager if they can afford it, maybe a low profile manager who can take care of all this communication part. आज के डेट में 20-25-30 हजार में एक अच्छा MBA मिल जाएगा to start freshers who can take care of most of this thing. So I'm surprised when they are earning so much, why not to entertain the patient? At least when the patient arrives, they should be heard properly, right? If they are kept waiting, they should be communicated कि कितना देर बैठना है. मैं बहुत बार जाता था तो बोलते थे आधा घंटा बैठना है, आधा दिन निकल जाता था. Still my number is not there. Then they should at least call the patient accordingly. That can be done. It is not a rocket science. That giving you time, yeah. If they give me a time of 11:30 and giving other patient a time of 12 o'clock, right? That can be done. तो उसमें मुझे क्या hardly 10-15 मिनट बैठना पड़ेगा, isn't it? So it is very it doesn't require means lot of hard work.
अब थोड़ा हॉस्पिटल्स इस तरीके से अरेंज हो रहे हैं एक्चुअली. They are understanding in that way. Like abhi because na Bangalore and all, so like people don't have time, they're not going to wait, so they'll call on the phone also that madam you come on that time because there is 8 patients before you, so please come by that time so that the doctor will be available for you.
Right. So this all this improvement, yeah, as you said, I've observed few hospitals and few clinics, they are working on it. In fact, they have already, and it's very logical common sense approach where you can make your patient at ease, right, comfortable. That is what is needed. Already patient है और उसको आप 2-2 घंटा बैठाओगे वहां पे, and the patient is not alone. He's there with somebody, a relative, maybe a father, daughter, whoever it is. So you are also what? You are also encroaching on their timings also.
And even clinics are going up. मतलब one more steps ahead of it. Like अगर बच्चे का क्लिनिक है, कोई बच्चे को बुखार है या रो रहा है, पेन में है, तो they'll say कि अभी पहले इसको दिखा लो, बाद में दूसरे पेशेंट को देखेंगे. वो they'll go personally and they'll talk to another patient that madam, this child needs urgent attention. Can you please like let him go on your number and we'll see you later on. So people also, I have that kind of empathy कि okay यार, मेरा भी बच्चा है, इसका भी बच्चा है, it's okay, let them go.
Right. Even I have seen that. It is happening. It is happening now.
Yeah.
And to say the entire medical fraternity should learn actually. See, you are not dealing machines. जैसे मैं मेरी कार सर्विसिंग को डालता हूँ तो ठीक है, चल जाएगा, वो वेट एक दिन ज्यादा लगेगा. You are dealing here humans, and humans, as
It's
you
a
know,
very sensitive thing. Yeah.
sensitive. They are very emotional, right? Probably they are hurt, they are suffering. So you have to be very specific. You have to be very particular about them. You cannot treat them like any other commodity.
Obviously, because यहाँ जो आया है वो already suffer कर रहा है.
Already suffer कर रहा है.
He is in pain.
He's suffering by health. He's suffering by financially also. He or she is suffering. So that part, the hospital, I think they should make a manual only, a handbook, how to treat a patient, right? What are the steps that should go right at the time of discharge? So
but sir, medical college में ये नहीं पढ़ाया जाता है actually.
नहीं, but ये बहुत जरूरी है.
पढ़ाना चाहिए डॉक्टर्स को, एक्चुअली डॉक्टर्स को पढ़ाना चाहिए. कोड ऑफ एथिक्स पढ़ाते हैं बट ये नहीं पढ़ाते हैं.
नहीं, ये तो उनको लगता है कि मार्केटिंग का ये है, तो ठीक है, मार्केटिंग का है तो आप इसको मार्केटिंग प्रोफेशनल हायर कर लीजिए. बिकॉज सी अल्टीमेटली द पेशेंट इज गोइंग टू सफर, नथिंग एल्स. आपको लगता है कि मुझे क्या जरूरत है, मेरे पास तो पेशेंट आ ही रहे हैं, व्हाई शुड आई हायर? बट दैट इज नीडेड नॉट फॉर यू बट फॉर द पेशेंट.
पेशेंट करेक्ट.
आपको ठीक है, आपको जरूरत नहीं होगी, बट ये छोटी छोटी चीजें जिससे क्या होता है कि पेशेंट तो आधा वैसे ठीक हो जाए. इफ डॉक्टर स्टार्ट कम्युनिकेटिंग प्रॉपरली, इफ दे टॉक, बहुत सारी चीजें आसान हो जाए. और इनफैक्ट डॉक्टर का ही भला होगा उसमें, पेशेंट का तो होगा ही होगा, बट
आपका पेशेंट जल्दी ठीक होता है ना, रिकवरी अच्छी है.
डॉक्टर को ही लोग वर्ड ऑफ माउथ जो बोलते हैं ना, पब्लिसिटी. देखो, आपके मेडिकल लाइन में यू कैन नॉट डू अ पब्लिसिटी, यू कैन नॉट एडवर्टाइज फॉर योर सर्विसेज.
Nowadays, the advertisement has started actually for doctors and all also. But before we didn't advertise. We never advertise ourselves.
You cannot, as an individual, you cannot advertise. As a hospital, you can advertise. And that doesn't come under your code of ethics also. That advertising myself that I am the best kidney doctor, or you won't see such type of ad. It is not. It is not allowed.
Through some institution, we can like do that.
Institution, yeah, institution definitely you can advertise. That is allowed. But word of mouth जो बोलते हैं, that is the most powerful promotion. Word of mouth कि मैं ठीक हो गया तो I went and I've shared my experience with my relatives, with my friends, and they shared with their relatives and friends, and that spreads very fast, and that is the best and the cheapest, I would say, free publicity, not cheapest. In fact, it comes for free. And how it is, and how it is going to come? Through empathy, through proper communication, through knowing your patient properly, right? So this is the user perspective and user involvement. We have already seen this, how to get them involved. Why user involvement in design? See, designing a health service nowadays, many hospitals, they are also consulting, they are also taking advice, or they are also involving the patient in designing of their healthcare facility, because they know ultimately the biggest stakeholder is the patient, and they should know what patient exactly want, what are the things they would like to have from them. So people with disabilities, what are the extra things that are like improving transport to the treatment units, improving accessibility, all these things, they can get it known from the patient. Here again, it is same. How is user involvement practiced today in the design of, See, WHO, you know what is WHO?
World Health Organization.
World Health
Everyone knows now. After COVID, everyone knows.
Everybody knows the importance also of WHO. So WHO classified measures to support user involvement in 3 categories. That is, first is choice, voice, and representation. How are you going to get involved the patients or the stakeholders in design of healthcare services?
Yeah.
It is through choice,
Choice,
giving
voice, and
right?
representation. Yeah.
Yeah, then voice and representation. There has to be a representative from patient side in the boards and the committees. Whenever committees form, you cannot leave out the patient, right? And just think for yourself what is needed for us, and the main stakeholder, who is the patient, you are not involving them. At least a small suggestion might be of a very larger help to the service, for designing of service, for designing of that facility. So you can always remember choice, voice, and representation. And this I'll skip. This is something related to the same level of involvement. Design by the user, design with the user, design for the user, and design without user. These are the level of involvement. Design by the users is not very practical
Sir,
because
your video is gone actually.
it's not visible. Which video? Sharing is available. Hello. Hello. Am I audible, Priyanka? Priyanka, am I audible? Priyanka, am I audible to you? Hello. Priyanka, am I audible to you? And actually, I'll end the meeting, Priyanka. We are almost done with the timing. Okay. Thank you, Priyanka, for joining. Thank you so much.
Am I audible?
Yes, yes. Now you are audible.
Yeah.
Am I
Now,
audible
your
to you?
voice is breaking a lot actually before that.
Okay, okay. I do not know, but there must be some
The
connectivity.
last slides, like that WHO slide and yeah, this one, the graph slide. Yeah.
So yeah, this is a very simple graph which shows the level of involvement of the stakeholders, right? So design by user itself is not practically viable or feasible because you need to get involved all the stakeholders, because implementation will be very low if it is done designed by the user. Design with the user is what is recommended. Design for user, design with the user is what is recommended ideally, and design without user is not recommended at all, because exploration will be at its lowest, 0. Okay. It's very simple graph to show what is ideal. So the midpoint somewhere over here, design with the user and for the user, somewhere in between, okay, where the rejection will be at the lowest and where the implementation will be at the fullest. So that is all, Priyanka, for today. Next time we'll be meeting with, yeah, next time we'll be talking on this patient portal and all those things stuff. Right?
Okay. It's still left, this unit. Yeah.
Still, we need at least 2-3 sessions for this. Right?
Okay.
We need more sessions. Okay, fine. Thank you so much.
Sir, thank you, sir. Thank you. Yeah.
Bye-bye. Take care.